Corneal ulcer in a failed corneal graft, a penetrating keratoplasty. Here we can see we have a patient who's had a previous penetrating keratoplasty. You can see that there's one remaining suture, but that's been attempted to be removed but broken in the process. So we can tell that this corneal graft happened at least a couple of years ago. The graft unfortunately failed, and in the past 24 hours the patient complained of redness, pain, sensitivity to light. We can see that they've developed a corneal ulcer on the graft, and this can be a particular problem because they've had reduced corneal sensation, and you can see there's actually quite a lot of cells in the anterior chamber there too. Now, having a failed corneal graft, and actually a corneal graft anyway, is a risk factor for developing infectious keratitis due to the long-term steroid use which patients take, and so we need to treat these infections aggressively. We need to reduce their topical steroids, take a corneal scrape, and commence intensive topical hourly antibiotics day and night. So in this case, we initiated hourly levofloxacin eye drops day and night for the first 48 hours. And really, this patient was waiting for another corneal graft, a replacement penetrating keratoplasty for this patient because the graft had failed. But we really need to make sure that there's no infection whatsoever, the eye is calm and quiet before we consider replacing this graft, because that in itself would be a risk factor for the failure of the new graft as well. There we are just measuring the size of the corneal epithelial defect, and that's important as we can monitor. And look at that redness, that's some scleritis as a result of the inflammation from the infection.